Have you ever noticed that your loved one seems a bit different lately? They appear more tired, no longer excited about things that used to make them happy, or suddenly losing weight for no apparent reason. Try to recall. The last time you saw them, was there anything unusual? Are they eating less? Sleeping more? Looking weaker than before? If you nodded to any of these questions, please leave a comment "I have noticed" below, because you are not alone in this. Many families once thought that old age meant that one day, their loved ones would suddenly be gone. But that's not the case. The body often sends silent signals, warning long before the inevitable happens. Unfortunately, most of us only realize this when it is too late. If you have ever heard someone say, "I wish I had noticed sooner," then you understand how painful this feeling is. So how do we not miss these signs? How do we know when our loved ones need special attention? In this video, I will share with you 5 important signs that the body sends out in the last year of an elderly person's life. You may have seen these signs before but overlooked them, or thought they were just normal signs of aging. But in reality, they are important warnings, and if recognized early, you can help them feel more comfortable, experience less pain, and most importantly, not leave behind any regrets. But before we get into the main content, I want to ask you one thing. Have you ever experienced anxiety when seeing your loved one change and not knowing what to do? If so, please share your experience in the comments. It could be a story that others need to hear so they don't feel alone. And if you find this video helpful, please hit like to help YouTube recommend this content to more people, those who also need answers like you. Stay until the end of this video because the upcoming information might change the way you view the remaining time with your loved one. And now, let's start with the first sign, a clear change that is also the easiest to overlook: unexplained weight loss. Sign 1. Unexplained weight loss. Think about it. The last time you saw your loved one, did they seem thinner? Are their clothes looser than before? Does their face look gaunt, and do their arms seem skinnier? This is one of the most important signs, but is often overlooked. Families often think it's just a normal change of aging or that their loved one's appetite has decreased due to not feeling hungry anymore. But in reality, unexplained weight loss is an important signal that the body is gradually weakening. Losing weight without a clear reason is rarely a normal sign. As one enters the final stages of life, the body struggles to absorb nutrients. The digestive system no longer functions as efficiently, the process of converting food into energy slows down, and the result is weight loss even when elderly people continue to eat normally. This is not just about the number on the scale, but also signifies muscle loss, decreased energy, and weakened immune system. So, why does this happen? There are 3 main reasons. First, decreased appetite. At a certain age, the body no longer sends hunger signals as before. Food becomes less appealing, taste changes, and some may even find food bland and tasteless. This causes them to eat less without realizing it. Second, muscle loss and reduced metabolism. When the body does not absorb enough protein, muscle mass gradually declines, making mobility more difficult. When losing muscle, the elderly become weaker, are more prone to losing balance, and face a higher risk of falls. Third, underlying health conditions. Sometimes, weight loss serves as a warning sign of serious health issues such as cancer, heart failure, kidney disease, or even depression. Some of these conditions progress silently in the body before showing clear symptoms, and weight loss is one of the earliest signs. Consider whether your loved ones are experiencing this situation. If so, do not rush to force them to eat more, as forcing food when the body has entered a weakened state is not the solution. Instead, focus on helping them consume easily digestible foods, soft protein supplements like milk, nourishing porridge, or their favorite energy-rich foods. Allow them to eat according to their needs, but ensure that what they eat still helps maintain their health. If you have ever noticed weight changes in a loved one without understanding the reason, please leave a comment, "I have seen this," so we can share experiences. And if you found this section helpful, don't forget to hit like so YouTube can continue to spread this information to others who need to know. Unexplained weight loss is the first sign, but it is not the only sign. The next sign may be even more concerning, as it directly affects daily quality of life: prolonged fatigue and weakness. Sign 2. Prolonged fatigue and weakness. Have you noticed that your loved ones are sleeping more than usual? Do they often complain that they feel exhausted even though they haven't done anything strenuous? They might have previously been able to take walks, cook, or talk for hours, but now just walking from one room to another leaves them breathless and needing to sit down for a while. If you have observed this, it's not just due to aging. Prolonged fatigue is one of the clearest signs that the body is entering a serious decline. Fatigue is not just a temporary feeling of sleepiness or lack of energy. It is a state of total depletion, where even the simplest activities become overwhelming. Getting out of bed in the morning is a challenge. Maintaining a conversation becomes difficult, and even when trying to do something, they quickly feel exhausted and want to rest immediately. The causes of this condition stem from multiple factors. Firstly, as internal organs begin to decline, the body prioritizes maintaining the function of the most vital organs such as the heart and brain, while reducing energy for other activities. As a result, elderly individuals tend to feel more fatigued and lack the ability to move as they did before. Secondly, due to weakened blood circulation, the amount of oxygen reaching the muscles and brain is not as abundant as it once was, leaving them in a constant state of lethargy, lack of focus, and quickly fatigued. Thirdly, their sleep may no longer be as deep as before. Despite sleeping more, they still wake up feeling tired, lacking energy, and reluctant to do anything. Sadly, many elderly individuals who find themselves in this state will gradually withdraw. They no longer want to engage in communication, participate in activities they once enjoyed, and sometimes even avoid family members. Many feel embarrassed that they can no longer manage simple tasks. They do not want others to see them weakening, so they choose to remain silent and reject help. So, what can you do if your loved one is experiencing this situation? The most important thing is to respect their limits. Do not try to force them to exert themselves or ask them to do things they no longer have the energy for. Instead, ensure they have a comfortable environment, allowing them to rest when needed while still maintaining some light activities to promote their health. You might also consider changing their diet, incorporating foods that boost energy such as high-protein and healthy fat foods. If you have noticed your loved one sleeping more, speaking less, or seeming exhausted even when not active, please share your experiences in the comments. The feeling of helplessness when witnessing a loved one decline day by day is not pleasant at all, but you are not alone in this. And if you find this content helpful, don't forget to like it so that more people can access this important information. Prolonged fatigue and weakness are signs that cannot be overlooked, but they not only impact physical health but also have a strong effect on mental well-being. What happens when an elderly person is not just exhausted but also gradually losing clarity and connection to the surrounding world? Let's explore in the next section. Signs of cognitive decline and withdrawal from daily life. Sign 3. Cognitive decline and withdrawal from daily life. Have you noticed that your loved one forgets more than before? Do they often repeat questions, lose their way even in their own home, or sometimes look at you and fail to remember your name? If these things happen, it's very likely they are experiencing cognitive decline, a sign that their body and mind are gradually entering a state of deterioration. Forgetting a few small details is normal with aging, but if forgetfulness becomes serious and affects their communication and daily activities, it is no longer a small matter. Your loved one may struggle to remember the names of acquaintances, forget why they entered a room, or be unable to follow a simple conversation. Some may even get confused between day and night, feeling disoriented even in familiar spaces. In addition to memory issues, many elderly individuals in the later stages of life withdraw from life. They may no longer want to converse, participate in family activities, or even care about previous hobbies. They might sit in silence for hours, avoid eye contact with those around them, or no longer express emotions as they used to. This is not because they no longer love their family, but because their brains are no longer functioning as they did before. The best way to support a loved one in this condition is to create a quiet and familiar environment. Be patient, speak to them in a gentle tone, ask simple questions, and do not pressure them to remember what they have forgotten. Music, old photos, or familiar stories from the past can help them feel more connected. If you have ever experienced the heartache of watching your loved one become increasingly distant mentally, please share your story in the comments. And if you find this content helpful, don't forget to like it so that the video can reach more people who need support in similar situations. Sign 4. Changes in breathing pattern and difficulty breathing. Have you ever heard your loved one breathing slower, occasionally pausing for a few seconds before breathing quickly again? Or do they sometimes breathe shallowly and rapidly even while sitting still? This is not just a normal change, but an important sign of declining bodily function in the final stages. As the body gradually weakens, the circulatory and respiratory systems also become less effective. The amount of oxygen that the body needs is not being supplied adequately, leading to changes in breathing patterns. Your loved one may experience breathlessness even when not doing anything strenuous or feel uncomfortable because they cannot get enough air into their lungs. Some may exhibit Cheyne-Stokes breathing, which is characterized by alternating between rapid breaths and long pauses. This sign can last from a few weeks to several months before the body enters a more distinct stage of weakness. The most important thing is to help them feel comfortable. Place them in a more breathable position, use pillows to elevate their upper body, keep the space ventilated, and if necessary, consult a doctor regarding supplemental oxygen use. Witnessing a loved one struggling to breathe can be a deeply anxious experience. But understanding the causes and knowing how to ease their discomfort can help you feel more at ease. If you have observed this in a loved one, please share your experience. The more people who understand this sign, the better families can prepare for what lies ahead. Sign 5. Changes in skin and sensitivity to temperature. Another sign that many families overlook is the change in skin color and temperature sensitivity of their loved ones. Have you noticed their hands or feet feeling colder, their skin becoming pale, or the appearance of purple or bluish spots at their fingertips and on their feet? These are signs that blood circulation is poor and the body is focusing energy to maintain the most vital organs. During this stage, the circulatory system begins to deteriorate significantly, and the blood flow to the hands, feet, and skin is no longer as abundant as before. This causes the skin to become thinner, more prone to bruising, and susceptible to injury. Some individuals may feel cold even when the room is warm enough, or conversely, their bodies may feel hot without an apparent cause. This is the time for families to focus on keeping them comfortable. Use a warm blanket if they feel cold, but don't wrap it too tightly to avoid discomfort. If they feel hot, keep the space ventilated and gently wipe their face with a damp cloth. Small gestures like holding their hand or gently rubbing their cold feet can help them feel loved and safer. These changes in skin and temperature are not only physiological signs but also part of the natural process as the body enters its final stages. The most important thing is not to try to reverse these signs, but to ensure your loved one is as comfortable as possible in their remaining days. Conclusion: the best preparation when noticing these signs. Recognizing these signs is not easy, as they mark a reality that no one wants to face. However, instead of fearing them, see them as an opportunity to prepare, to ensure that your loved ones have peaceful, pain-free final days filled with love. The most important thing is not to try to keep them around longer, but to make the remaining time meaningful. Spend time beside them, listen to them, reassure them when they feel anxious. Sometimes, a handhold or a gentle word can provide greater comfort than any medication. If you have witnessed these signs in your loved ones, please share your story in the comments. You may be helping someone no longer feel alone in facing this situation. And if you find this content important, please like and share it so that this useful information can reach more people. Life is finite, but love never fades. Cherish every moment left with your loved ones.